Hey guys, Dr. Chad here. Today I want to talk about sleeping positions. This is something that I get asked all the time. So basically, we want to keep your spine in a line no matter when, no matter what you're doing, and especially when you're sleeping. Most people talk about how they just feel like in the morning it just takes them a lot longer to get up. They got a lot of aches and pains. Well, most likely you're in a bad sleeping position that's actually subluxating you, which is creating a lot of dis-ease in your body, creating pain, creating disease as well. So my main goal is looking at my pillow, okay? So I don't want a really firm pillow. I ultimately want a pillow that's going to keep my spine in a line, okay? So if I'm on my back, which typically people are, when people sleep, they usually have their shoulders on their mattress, and then they put their head on their pillow, and then they sleep with their chin to their chest. Now it's even hard for me to breathe when my head is tucked down like this. So this is creating a reverse curve. It's creating your spinal cord to stretch. So what I would suggest is one, move the pillow down a little bit and get your shoulders up on your pillow, and then get your head right on the pillow as well. So this actually aligns my spine much better than if my shoulders were on the mattress. The next step would be to take your cervical roll, the big one, and put that right underneath your neck, okay? So this is still going to create that nice smooth curve, that arc of life in your neck. It's going to keep the spinal cord nice and relaxed. It's actually going to help re-educate the muscles to hold this position for the day, okay? The next step is actually not to use a pillow at all, where you're just using the cervical roll and you got your head right on the mattress. So this is actually getting my spine even more in a line at this point as well, okay? If you're more of a side sleeper, which most people are, right, what I want to do is one, be on my side, but again, I want to keep my spine in proper alignment. So I don't want a pillow that's going to kink my neck like this, and I don't want a pillow that's too shallow that's going to make me sleep like this, okay? So what I'm focusing on is a pillow that's firm enough that will keep my spine in proper alignment when I'm on my side, right? I'm actually more on my shoulder blade than I am my shoulder, okay? And I also have my knees or my legs kind of tucked here. The next step would be to use, this is one of our decorative pillows and it works great, it's just a smaller pillow. This should go between your legs. What this does is actually keeps your SI joints open, rather than creating a lot more pressure in your lower back on your hips. So by having a pillow in between your legs, this will take a lot less stress on your spine. It'll keep your spine in line when you have a pillow like this, okay? And actually I want you to lay more on your shoulder blade than your arm, okay? Now if you toss and turn throughout the night like most people do, you're just gonna keep the pillow in between your legs and rotate around. So as you can see, I'm more on my shoulder blade than I am my arm. Does that make sense? What I do not want you to do is sleep on your stomach. If you're on your stomach, you're literally turning your head so far that it's straining the muscles and the bones and the joints in your neck. It actually occludes an artery when you sleep on your stomach, turning your head this far, okay? This is creating more subluxations. It's enhancing more degeneration in your spine. The last thing that we want. Degeneration is something that will destroy your health, and we don't want that for anybody. So by you getting adjusted, that's one of the best things you can do for your spine. For you to keep your adjustments, the best thing to do is sleep in a proper position, okay? Other ways of trying to fall asleep on time would be turn off the TV, okay? Just turn your TV off. start to put yourself into sleep mode so you can have some chamomile tea at night. I like to have chamomile tea or like a sleepy tea, a bedtime tea, something that's gonna start to calm my nerves. The TV's off, so I don't have that flickering light in my brain, keeping my brain on. I also want to go to bed on a reasonable hour. So for every hour of sleep you get before midnight counts as 2 hours. So I want to get as many hours in for sleep before midnight, because everything after midnight would just be a great bonus. So my goal is to be able to wake up refreshed and excited for the day. I know when I go to bed late or try to sleep in even, I feel very groggy and tired. When I go to bed 8:30, 9 o'clock, reading a story, falling asleep, getting good deep sleep, I can wake up refreshed and be more effective in daily routines. So other routes would be to take melatonin. Basically, you want to take melatonin forever, but what melatonin does, it's a hormone that your body naturally produces. But if you take the supplement, it'll help reset your circadian rhythm, so your sleep clock, and you can start going to bed more on time and getting a better quality of sleep. Those are just a couple tips that I would have for you. We also have a dream and mood supplement. We also have a dream supplement in the office, all to help you get a better quality of sleep. So again, go to maxhealthchiro.com, go to the patient portal. There's lots more information, lots more videos, lots more food recipes, things, and newsletters to help you be as healthy as possible. So any questions, just ask your doc. If not, start implementing a healthier sleep pattern and give you the best energy and the best health you can. Thanks, guys. God bless.